I too would like to acknowledge the traditional owners of the land on which we meet today, and would also like to pay my respects to elders past and present and any elders here today. It's my pleasure to be here with you this morning, and as I look around the room I see some familiar faces, so that's always really nice, and to open this forum and congratulate the Victorian Clinical Network for Paediatrics for coordinating such a forum. There's obviously enormous interest in this topic, given the number of people here in the room today, as well as those that are webinaring into the forum this morning. As Peter said, I've got the privilege of holding the role of the Chief Nurse and Midwifery Officer for Safer Care Victoria. And Safer Care Victoria, we opened our doors on the 2nd of January this year, and our role is to ensure that our health services are providing safe, high quality care to patients every time, everywhere. As well as monitoring the standards of care provided, Safer Care Victoria partners with patients, clinicians and health service managers to support continuous improvement in healthcare. And the Paediatric Clinical Network is part of Safer Care Victoria, and I think they cover off all of the things that I've mentioned that Safer Care Victoria is charged to do. I don't need to tell you about type 1 diabetes. You know much more about the topic than I do. But as you know, type 1 diabetes is a chronic condition that can't be prevented and can't be cured. I'm sure that there's people out there today that are looking for the cure for type 1 diabetes, but at the moment we know that it is chronic and there is no cure. And that managing this condition requires that blood glucose levels maintain at an optimum range. Excuse me, the cold weather's got to be this morning. Through a balance of food, physical activity and medication. And we know that when people consistently have a high HbA1c level, that's a strong predictor of risk of developing chronic long-term diabetes-related complications. And I had an uncle who had type 1 diabetes, and he was a perfect example of someone who didn't manage his diabetes particularly well, so developed the range of complications that we're all aware of people with diabetes developing. As a mother of two teenagers, I know that certainly adolescence is a very tricky time, and adding a chronic illness such as disease such as diabetes into the mix further complicates matters. Nobody tells you about adolescence and the challenges of adolescence when you go to birth classes, so they don't tell you the full picture. And as we know, as children move, from childhood to adolescence and then young adulthood, that's a time of lessening parental influence and the increasing influence of peers and increasing independence. And certainly, I had that challenge this morning about increasing independence, as my year 12 son went off with a mate who got his licence yesterday, driving to school. So adding that to for parents who have got a child with type 1 diabetes, and moving through those years only really highlights and heightens the challenges. I think today the program that you've got today, starting with the parent perspective, so that really partnering with consumers, I think is a really great way to start the day. And certainly Lisa will be able to really highlight the challenges of being a parent of someone with type 1 diabetes. You know that the federal government provides assistance for those without private health insurance to have access to an insulin pump. Of course, you know, having an insulin pump requires a high level of motivation, and I understand that there is a range of views about the evidence of pump therapy, the provision of pumps, and the multidisciplinary team that are required to commence and maintain someone on a pump. In April this year, the federal government also announced that it will provide continuous glucose monitoring to eligible children. So that will certainly help in terms of monitoring those levels. The diversity of speakers that you've got today, I'm sure will generate much discussion, and you know, coming into the room only a few minutes ago, there's certainly a hub of discussion. The way that the room is set up certainly facilitates that level of discussion and interaction, and there'll be lots of opportunities to talk today and into the future about how we actually improve the safety and care of those in our community that are living with type 1 diabetes. So make the most of this morning and the range of speakers that are here, and I look forward to certainly hearing back from the clinical network the discussions and the outputs from today, and thanks for inviting me this morning. Thank you.